In this video, we are going to cover the anatomy of the skull. Now, this is quite lengthy. We've got a lot of bones and features here. I'm going to try and go in as organized a manner as I can. I just want to remind you, as well as in case you're not in my class, the colors of the popsicle sticks have nothing to do with organization. It's just the colors I happened to have. So there's no meaning to the colors. So let's begin. I have it on a fixed focus, so I apologize if it goes in and out of focus. Hopefully we can manage pretty well though. So we've got our cranial bones here that we're going to cover. We have flat bones of the skull. The bone that we refer to where our forehead is our frontal bone. We have two side bones, left and right, which are our parietal bones. On the sides, here and here, we have our temporal bones, and on the back, we have our occipital bones. So you may have noticed that these bones match the names of the lobes of the brain that they protect. So the frontal lines up with the frontal lobe, parietal lobes, temporal lobes, and occipital lobe. Connecting these flat bones are a special joint called a suture, called that because you can kind of see it's like stitched together, almost like it's been sewn. And sometimes as these sutures are forming, a bone will kind of get like formed within the suture. That's called a sutural bone, if that is the case. I can't really see any on our model at the moment, but some of the models do feature some of the sutural bones. At birth, these are not fused. That allows compression as baby comes through the vaginal canal. If baby is born with fused sutures, they are likely going to need to be surgically separated because having these sutures not formed is going to allow growth of the brain, and so we need that space, and then they fuse during development. Speaking of, so as we have these sutures, they do have specific names. The suture that's going to connect our frontal to our parietals is called the coronal suture. Coronal meaning crown, so it's kind of like where you would wear a crown. In between our two parietal bones, we have our sagittal suture. So that's going to run in the sagittal plane, okay, separating left and right. On the sides, and ours are a little bit worn, where the temporal bone is, hopefully you can see this bit of suture being shown. This is our squamous suture. I kind of think of if the squamous suture is if you're going to put your hair behind your ears, you're kind of tracing along that suture. And then finally on the back, we have our occipital bone, which is going to be connected by this suture here, the lambdoid suture. I'm going to pause and pick up so that we can cover some of the facial features. All right, so we're going to pick up with the anterior view of our skull. I hope that he stays in focus for you. I'm going to start off here just as a reference. This is our frontal bone, so our forehead. And we have our very obvious eye sockets that we call the orbits. Okay, so orbit, orbit. If you look straight back in there, you can see that hole there. That is going to be our optic canal. So that's going to allow our optic nerve to pass through from our eye. And there's a couple of bones that make up the orbit. The one that is closest to where the tear duct would be is called the lacrimal bone. The inner, kind of more posterior, is going to be your ethmoid. And then back here, this guy here, as well as the superior surface, this is our sphenoid bone. Okay. The sphenoid and the ethmoid we will discuss again as we look at the interior, right? So orbit, sphenoid, ethmoid, lacrimal, optic canal, orbit. Below the orbit, we have a foramen on each side. Remember, foramen means hole. This is our infraorbital foramen, so it simply means infra below, orbital is eye socket, foramen is hole. So below the hole, below the eye socket hole. So infraorbital foramen. Okay. In between our orbits, we have our nasal bone. Okay, right here, kind of like that bridge of our nose. And the septum in between that is separating the left and right is our vomer. We are going to see this again when we turn to the inferior side. We also have these nasal concha, which I do not have as part of your practical. Just know that they are called concha because they are kind of swirled like a conch shell, and they serve the purpose of circulating the air that's being inhaled through your nose to help moisten and humidify and warm the air as it goes into your lungs so that it's more comfortable for your lungs. Whereas I'm sure if you've ever, been in very dry, cold weather, it kind of hurts to breathe. The air is uncomfortable in your chest. And so those nasal concha are going to help circulate, warm, humidify, and kind of prepare that air for our lungs. You have your cheekbones. The actual bones are your zygomatic bones. And whenever we have a bone that extends off of, we call it a process. So this is an extension off the zygomatic bone, so we call it a zygomatic process. So zygomatic bone, zygomatic process. The upper portion of the mouth where the teeth are going to be held is our maxilla. The bottom portion of the jaw is the mandible. And on our mandible, we're going to get into more details of the mandible in just a bit, but you can see these two holes on either side. These are called the mental foramen. Okay. So we're going to pause here. We're going to go a little more deeper into the mandible when we return. Let's go ahead and focus specifically on the mandible. So I have taken his mandible off so that we can get a better look. Sorry about that. And so this entire bone here is the mandible. I'm going to turn it laterally so we can look at it from the side. This back portion here is our mandibular condyle. The word condyle means knuckle. Okay, and we're going to see that we have condyles in a lot of our joints where articulation is occurring, so where there's movement. So this is our mandibular condyle. You then see this kind of scoop that's been taken out of the mandible. This is our mandibular notch, so I like to think of a notch as a scoop. So this is our mandibular notch. And then this extension here is our coronoid process. Off of the where the condyles are, you have the ramus. Ramus is kind of like an arm. You have the angle here where it turns direction. And you have the body, which is like the chin. Finally, there are two sets of foramen. If we are on the inside, you can see that we have these mandibular foramen. So again, our mandibular foramen, they are on the interior of the mandible. And then if we turn to the anterior side, we have our mental foramen. Now that we've covered the mandible, we're going to go ahead and switch gears. We're going to look at the inferior surface of the skull. So I'm going to go ahead and set that up and be right back with you. All right, now we are set up to look at the inferior side of the skull. There is a lot going on under here, so I'm going to try my best to keep things as clear as possible. And to help with that, I've got my labels here on the side. I'll go in order here. So here we go. Just to give you a little bit of reference, here is our occipital bone, although I took his cap off. Okay, occipital bone, so that's the back. And we have this little extension here, this projection called our external occipital protuberance. Okay, external because it's on the outside, occipital, it's on the occipital bone, protuberance because it protrudes. And we're going to have muscular connections here that allow us to pull our head up, so kind of like look upwards. If we follow from that external occipital protuberance, there is a very obvious foramen here. This is our foramen magnum. This is where our spinal cord and brain are able to connect, thanks to this passage here. And on either side of our foramen magnum, we have these condyles. Remember, condyle means knuckle, so you can kind of see, it's kind of like the knuckles. This is our occipital condyles. They are going to line up with the lateral masses of the atlas so that you can nod your head yes and no. Okay, so those kind of glide along the atlas. From there, a couple of ways you can see it. This seems to be a pretty decent view. We're going to look at the jugular foramen here, and I'm going to steal this popsicle stick. This hole right here. It's kind of shaped like a peanut, so I kind of think of the jugular foramen as the peanut hole. That's where our jugular vein is going to pass through. And just in front of that, you have your carotid canal. This here. See where it kind of looks like there's a little pinhole there? That is our carotid canal. This is a canal because it's more like a tunnel, whereas a foramen is a hole that just goes right through. Our carotid canal, the hole actually comes to a stop in our model because in your skull, as soon as the carotid canal kind of goes through the base of the skull, it turns, and so you can't see straight through it. Okay, so this one here, where that little pinhole is, oops, I'm sorry, right here. This guy right here, that's our carotid canal. Two more sets of foramen or foramina I want to talk about. Out to the sides, here and here, you have your foramen ovale. They are oval shaped. I also think of them on the outside, like an O. Foramen ovale. And then medial to those, you have two foramen, the foramen rotundum, right here. Okay. Quite a bit of activity going on over here. I'm going to turn him laterally. Starting off, you have this hole here. This is your ear canal. So, I mean, if you're holding him properly, you can kind of see this is where his ear would be. And so this is our external acoustic meatus. External meaning on the outside, acoustic referring to sound, meatus being a passage. Okay, so the outside sound passage, external acoustic meatus. If you go posterior to the external acoustic meatus, you have this large bump, which is called the mastoid process. Oh, that's a good view right there. And anterior and a little bit medial to that, we have this point. It's quite sharp. It's almost like a fang. This is our styloid process. Okay, so when we have a styloid process, think about like a stylus pen, styloid. Just in front of that, you are going to have this little divot here. Anytime we have a depression, we tend to call it a fossa. This is our mandibular fossa. I know it's a little bit confusing because it's not actually on the mandible, but the reason it's referred to as the mandibular fossa, and let me try and find what I did with his mandible. Here we go. The mandibular condyles are going to fit right into that mandibular fossa, so that allows articulation there. So our mandibular here, and it's going to fit that mandibular condyle right in there, right? So again, just to reiterate, this area here, we have our external acoustic meatus, our mastoid process. This is going to connect some of our masseter muscles for mastication, which is the process of chewing, our styloid process, and our mandibular fossa. We're then going to turn and kind of focus on the nasal and mouth area. The very back, that is the roof of the mouth, is the palatine bone. And then where it extends forward towards the teeth is your palatine process. And then I had mentioned earlier, you can see the vomer. Okay, so I mentioned in the anterior view, this is our vomer here, the septum. You can see it again on the back. Okay, so this is our vomer. And on either side of the vomer, you have these pterygoid plates. The one towards the middle is our medial pterygoid plates. So medial pterygoid plate. And out to the edge, we have our lateral pterygoid plate. Last thing that we need to cover is the interior. All right, to give you a little bit of orientation, this here is where the face is. So this is the anterior. This here, being the back of the head, is posterior. This section here is the internal section of the ethmoid bone. So I mentioned earlier that if you look kind of in the orbit back here, this would be the ethmoid. We can now see it from the internal view. The ethmoid has two features that I expect you to know for your practical. This bump here is called the crista galli, and the crista galli is surrounded by this kind of spongy bone called the cribriform plate. So I think about cristas in the crib, right? Crista galli is in the cribriform plate. You'll see that there is a texture that's kind of spongy, like little holes and pockets. This is going to allow your olfactory senses, your neurons for your sense of smell to travel into the brain. From there, I also mentioned that if you look straight back, you have your sphenoid bone. So this kind of butterfly section is going to be your sphenoid. And you have two wings. The larger portion of the wing is your greater wing of sphenoid. This upper ridge here, this much smaller area, is our lesser wing. And right in the center of our sphenoid, you can kind of see the saddle shape. See, I don't know if I can really show it too much on the lateral view. Right here. This is called the sella turcica. It is going to serve as kind of the house for the pituitary gland in the brain. And so I just think the sella turcica is like a little saddle. And then finally, if we were to follow our external acoustic meatus, which we're not able to on our model, but if we were to kind of trace it along, we would follow it to this hole here. Because we're now on the inside, that is going to be our internal acoustic meatus. So our inside sound passage. Thanks for watching.